As a caregiver, if you would like to know the correct, or as a stroke survivor, if you'd like to know the correct way to stretch your muscles after you've had a stroke so that you get the maximum benefits from them, then this video has many, many tips for you and will explain why we stretch in a certain way. Hi there, I'm Dr. Kenneth Monaghan. I'm a university lecturer, a neuroplasticity expert, and the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm hugely passionate about adapting a stroke survivor's home to make it an ideal place for them to carry out their rehabilitation after they've had a stroke. Now, one of the treatments that I recommend, and it's part of the programs that I recommend in Lights, Mirrors, Action, is that a stroke survivor needs to do stretching on a daily basis. Stretching has numerous benefits, and in Lights, Mirrors, Action, in our chapter 14, we mention a particular Chinese study that talks about some of these benefits. And the benefits broadly are that when we stretch or we move the tissues on a regular basis, we actually make any existing spasticity that might be part of strokes, might be a result of the stroke, we make that discomfort a little bit more comfortable. If we stretch tissues and move them on a regular basis, we stop them from actually becoming permanently shortened. And permanently shortening of tissues is what's known as contractures in your human body. So stretching and moving tissues and keeping them, keeping them viable, keeping them warm, it increases the viscosity of the tissues, allows them to be stretched out a little bit more. So when we do this on a regular basis, we keep our tissues lengthened and we stop this potential contractures from developing. Obviously, when we stretch out tissues, we stop them from getting stiff. And when tissues aren't moved on a regular basis, and for myself, if I didn't move my shoulder for a couple of weeks, as well as the tissues, the muscles and the sinews and the tissues all around my shoulder getting a little bit stiffer, I would also feel very painful, because we have little proprioceptors, little sensors that are in our muscles and our tissues that send information at all times to our brains. So if these proprioceptors are not being activated on a regular basis, then it manifests itself as pain. So stiff tissues and joints and tendons that are not being moved on a regular basis, they can start to become painful. And then one other benefit, and we see this in sports people that do stretching before they play sports, is this idea of pre-activating muscles, and so that when we go to do activities with them, they perform better. And this is the same principle that works with stroke rehabilitation. So if a stroke survivor is going to be walking, or if they're going to be moving their upper limbs to try and do tasks, it makes a little bit of sense to go and stretch those tissues beforehand. So the question here is, and I know from my experience with stroke survivors and caregivers, very few people know exactly how to stretch correctly and what the principles should be. And here I'm going to use the example of Play-Doh. So most people have, if you have family, if you have kids, you probably have Play-Doh lying around the house. And if you take a piece of Play-Doh, a thick piece of Play-Doh, and you try to stretch it very quickly apart, you'll find that the Play-Doh won't go anywhere. It'll actually resist you. And the reason for this is that Play-Doh is actually what's called a viscoelastic material. And a viscoelastic material is one that if you apply force to it very quickly, it actually resists and comes against you. And the reason we're mentioning Play-Doh is, however, if we take that Play-Doh and we actually hold it and we put the minimum little bit of a stretch on it, but we hold it for a long time, well, then we find that we can move that Play-Doh much, much further. And this is the principle, and muscle tissue is exactly the same. It's a viscoelastic material. So when we apply forces to tissues to try and stretch them out, we need to do it in a very simple, very gentle, minimum resistance way. And this is the key point we're making here. So again, in chapter 14 of Lights, Mirrors, Action, when I show stretches for the shoulder, the elbow, and the wrists, I recommend that people hold stretch at the very minimum stretch they can feel. So if I'm lifting my arm in the air, I go to the point where I just feel the minimum stretch feeling in it. But I try to hold that for at least 30, maybe even up to 40, 50 seconds. And as I'm holding the stretch, I may notice I even am able to go a little bit further, but still feel that gentle discomfort. So this is the important point, is that, stretching your muscles like most people do, so that they're like a guitar string. So there's so much tension in them that they're almost twanging like a guitar string. It's a counterproductive technique. The muscles resist, you don't get as much out. It will stretch a small bit, it'll be uncomfortable, but it won't be as beneficial as if you do it where you feel a very minimum little bit of a stretch. And caregivers and stroke survivors, this is a very, very simple but very important point. Stretching should be part of your daily routine. It's so important that, if we're aiming to do our 3 hours every day, that we include a 10, 15, maybe even 20-minute stretching session in there, where we hold our muscles and tissues at a very minimum resistance, and we repeat it maybe 3, 4, 5 times on each side. And this will maintain the length and the viability of our tissues and is hugely beneficial. So thank you for listening. If you would like some more information or a little bit more resources on how to help you and benefit you, then please go to my website, which is www.lightsmirrorsaction.com. And there you'll find some extra resources, some of these video assistance guides. If you go to YouTube channel as well and go to Stroke Recovery at Home, you'll also find other videos that will assist you in developing that program at home. Thank you very, very much for listening, and I hope you enjoyed the message.